Did you know there's one simple 30-second trick that can dramatically ease your hip arthritis pain without medications, expensive treatment, or endless physio sessions? Hi, I'm Phil Evans, a physiotherapist who specialises in arthritis relief. After helping hundreds of clients over 50, I've learned that you don't need hours of therapy or strong painkillers to finally find relief. In this short video, I'll show you the exact method I teach my clients every day, which is an easy, safe technique you can do right at home to quickly reduce your hip arthritis pain and start moving freely again. You've probably been told your hip arthritis pain is just wear and tear, something you have to manage with medication, injections, or endless stretching. But here's the truth I share with my clients every single day. Often the joint itself isn't fully to blame. Instead, it's the muscles around your hip, especially your glutes and piriformis, that quietly tighten, they seize up and throw everything out of balance. When these muscles become overly tight, they lock up your pelvis, they compress nearby nerves, and they trigger that deep, burning, sometimes sharp pain you can feel in your hip or outer thigh. Here's the frustrating part. When you feel tightness, your first instinct might be to stretch it out. But if the muscle is already inflamed or in spasm, stretching can actually make things worse. It's a bit like pulling harder on a knot in a rope. So if you've been doing everything right, but nothing has helped, don't blame yourself. You've simply been missing one small but crucial step. I'm going to show you exactly how to do it safely right now. We're going to gently release your glute and piriformis muscle, easing pressure off your hip joint and giving you near instant relief. Think of your muscles as rubber bands. When they're overworked and stuck in a shortened position, they bunch up and painfully pull on everything around them. Instead of stretching that rubber band tighter, we want to gently decompress it. We do this using a simple, gentle pressure technique that anyone can do at home. You'll need just two things: a tennis ball, lacrosse ball, or massage ball, and a comfortable, soft surface to sit on, like a yoga mat, carpet, or folded towel. This method works best if you're comfortably getting down and up off the floor safely. Sit comfortably on your mat or carpet, knees bent, feet flat on the floor. Place the ball under one side of your glutes, just behind and slightly to the side of your hip bone in the soft muscle area. Slowly lean your weight onto the ball. Use your hands behind you to gently control how much pressure you apply. Aim for a dull, achy sensation, never sharp or intense pain. If it feels too strong, ease off slightly. Begin gently moving your hips in small circles or slow side-to-side motions, allowing the ball to roll around until you discover a tender spot. When you find a tender spot, pause there. Let your weight settle gently onto the ball for about 30 to 60 seconds. Breathe deeply as you exhale, consciously relax and allow your muscles to soften and release into the pressure. Gradually, you'll notice the muscle tension easing. That's your sign it's working. You might feel a gentle radiating sensation, and that's completely normal. However, if you experience sharp or nervy pain, just reposition the ball slightly. Release tension on one side, switch sides and repeat. Before we continue, let me quickly highlight a common mistake I often see: going too hard, too fast. Many people follow the no pain, no gain mindset, pressing the ball aggressively, but applying too much pressure can actually increase inflammation, especially if the area is already irritated. Here's a better approach. Start gently, let your body weight naturally do the work rather than forcing it. Use your hands or opposite leg to control and adjust the pressure. Take slow, deep breaths and give your muscles time to relax. You're not trying to aggressively break up a knot. Instead, you're gently reassuring your muscles that it's safe to relax. If getting down onto the floor isn't comfortable or isn't possible right now, don't worry. There's a gentler standing version that's equally effective. Stand comfortably next to a wall. Place the ball between your glute and the wall, just behind the bony part of your hip. Gently lean your weight into the ball, using the wall for support. Adjust your position slightly, bending your knees or using your hands for stability and to control pressure. Slowly move your body in small motions, up and down or side to side, to find those tender spots. Pause on each tender spot for 30 to 60 seconds, breathing deeply, softening and allowing tension to melt away. This version is perfect for beginners or anyone who prefers a gentler approach. Now that you're starting to feel your pain ease, this is the most important moment, because if you don't strengthen your hips right now, that relief won't last. The pain will slowly creep back, and it won't stop at your hips. It will spread into your knees, your lower back, even affecting how you walk, sleep, and enjoy daily life. That's why this next step isn't optional, it's essential. In the next video, I'll share 5 simple exercises to instantly end hip arthritis pain, specifically designed for people over 60. These gentle, easy to follow exercises will help you lock in your pain relief, strengthen your hips safely, and protect your mobility for years to come. I'll see you there.